Hi, and welcome back to the Mom and Mind podcast. I am your host, Dr. Kat. I am joined today by Danielle Silverstein of Marriage and Martinis. And I had the great pleasure of talking with her on her podcast just last week about perinatal mental health, and all kinds of great stuff came up in that conversation. And on this episode on Mom and Mind, she is sharing her personal experience through perinatal OCD. And as you'll hear, OCD can be quite debilitating. And she shares in this episode how some of the medical care she received contributed to her symptoms worsening. It's unfortunately something that other people can relate to, but it's also such an important story for us to hear because she talks about uh, how devastating things were for her during this period of time, but also how no matter when you figure out you've been through something, that healing is still available. Danielle knows the struggles of losing oneself amidst the busyness and chaos of life, and she is determined to keep finding, experiencing, and sharing methods of self discovery. She is also committed to being outspoken when it comes to such things as maternal mental health, and as you'll hear, a struggle that is very personal to her. She hosts the hit podcast Marriage and Martinis alongside her husband for the past 5, almost 6 years now. And that has led to some of the most raw and open and honest conversations that a real couple has ever shared publicly. Her wildly popular, record breaking book and ebook, The Date Night Questions Experience, has helped many partners around the world connect in a refreshingly straightforward and uniquely impactful way. Now, let's hear from Danielle. Welcome, Danielle. Thank you so much for being here.
Thank you for having me.
Um, I was I mean, you have such a huge platform, and the things that you talk about are so real and so relatable to so many people. And I mean, it seems like a lot of people resonate with you. And what you're going to be talking about today is part of one of the reasons, is because you're real about real stuff. And there's so many people who deal with things like perinatal OCD that sometimes don't even know what they're dealing with. So being able to hear from you, your experience, I'm sure will help a lot of people. So I'm grateful for that.
Thank you. I'm grateful for the platform that you give women to talk about it.
It's yeah, it's great. I mean, being real about stuff is my favorite. So
Totally. Same. As much as
okay.
Instagram will allow for.
Well, there you go. Right. Yeah. Yeah. Um yeah, so what happened for you? Let start wherever you'd like to start with your journey and what your experience was.
Sure. And I also want to say, just prefacing, as I'm sure so many women feel, I think my journey is something that I'm even realizing more and more about as I get older. I'm
Totally.
really unpacking it all.
Hmm.
And I was so young when I first got pregnant. Well, when we started trying to get pregnant, I think I was 26, which by today's standards is pretty young.
Hmm.
And my daughter is now about to be 19, my
Mm,
oldest,
mhm,
which was the pregnancy with the most complications.
mhm.
But this has been something that at the time I sort of felt like there was so much going on that I didn't understand. Um, but also at the time there was no language around it.
Right.
And so all these things that I was experiencing and my husband was experiencing, secondhand, and my
Mhm,
family and the doctors and everything, it was something that was so scary to begin with. And then it had that layer of, I don't know. Am I just crazy? I mean,
right.
am I going to be institutionalized? Is
Mhm,
this something that has only happened to me? There was nothing, it wasn't a conversation, even just 20 years ago, at
right,
least in my world.
right.
And I live in a pretty progressive place. I went to college in New York City, and,
Mhm,
I'm like, I feel like the people around me are very educated.
mhm,
Um, but this just wasn't a topic. It wasn't maybe important enough. I don't know. So when I was around 26, I had always struggled. OCD, obsessive compulsive disorder, runs in my family, as does
Mhm.
anxiety.
Mhm.
My mom was always very hush hush about it. She had it, and
Mhm.
as an older generation, she just didn't really talk about it. Although we knew she had it, and we knew strange things like the constant hand washing and
Mhm.
things like that.
Mhm.
But again, no language around it, so there wasn't much of a discussion because we didn't have the tools. I knew my grandmother had it, and there were just like I could hear chit chat around it.
Mhm.
And I certainly had signs of it when I was in high school.
Mhm.
Um, worrying about things that were not realistic. But
Right.
um, again, I thought it was anxiety.
Mhm.
Like I didn't know what it was.
Mhm.
And then I went to college and it got a little bit worse. But
Mhm.
I was like a fully functioning human
Right.
with like all this stuff going on in the back of my mind.
Mhm.
And then as I got closer to getting pregnant, I guess I wanted to be like the best mom I could be from the start.
Right.
And I had been on medication since I was like 17 years old. Um,
For
I,
anxiety.
yeah, anxiety and, OCD.
Uh-huh.
Um, and I told my doctors that I was on medication and said, should I go off of it if I'm going to try to get pregnant?
Mm.
And they just very like blasé said, yes, you should.
Mm.
No conversation.
Mhm.
And, so not knowing really what happens
Right.
when you go off medication,
Mhm.
I did it.
Mhm.
Pretty cold turkey.
Oh, wow.
Yeah. And,
Okay.
there was no conversations between like my doctors and my psychiatrist, or
Mhm.
there was no, well, yeah, the potential of you going off could be this, or, and I had never been pregnant before. I knew nothing,
Right. Right.
besides what you learn in middle school. So, so I went off my medicine, and pretty quickly the OCD symptoms started to really like, magnify.
Mhm.
And then I got pregnant pretty quickly.
Mm.
And from pretty much the beginning of my pregnancy, my OCD was, I mean, debilitating.
Like it had been prior to taking medication, or worse than it
Way
had ever
worse.
been. Okay.
I
Okay.
mean, so bad that I was working at this time. And, I was newly married. We had bought a townhouse, and, my husband knew nothing about the concept of OCD, and,
Mhm.
nor at that time, like, did he think to research it, and neither
Right.
did I
Right.
really.
Right.
Um, and it got worse and worse as the pregnancy went on. By the time I was in my second trimester, I had moved out of living with my husband and moved in with my parents, basically
Mm.
back into like my childhood bedroom.
Um,
Because I
be,
really could,
Sorry. Yeah. Go ahead.
no, 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 just because I could barely function. I was barely eating. I was, constantly worried about losing the baby,
Mhm.
constantly worried, I mean, if I would touch a table and I would think, oh my God, there's cleaner on the table. And every single thing made me panic.
Mhm.
And the asking, the checking, it was I had all of it to the point
Mm.
where, when I finally did go to an OCD specialist about 6 months into my pregnancy, he was like, "You really are like the OCD MVP." Like he's like, "You can turn
Oh,
anything
okay.
into OCD."
Uh-huh.
And and it was hard because first of all, no one really knew what it was. I didn't know I knew it had to be OCD, but
Mhm.
I didn't know that perinatal OCD was a thing.
Right.
I didn't know that there were doctors out there who probably would have known how to handle it.
Mhm.
I went to this, just someone told me the doctor to go to, and I went to them.
Right. Right.
Um,
Like an
and
OB or psychiatrist, or what kind
The
of doctor?
OB,
Uh-huh.
yeah, and then, and it was an all male practice,
Mhm.
and pretty much from the start, they didn't know how to handle me.
Mm.
And so I was treated like a crazy person and like an annoyance
Wow. Oh,
because, I would call a lot. I
right.
probably had what they considered silly questions.
Mm.
Um, and they didn't understand what was going on. They just kept saying to me, if you don't calm down, you're going to hurt the baby.
Oh, okay. Well, like
Yeah.
that's the worst thing to say to somebody who's anxious.
Oh, the whole thing. And, that's the thing is that at the time I knew it was terrible,
Mm.
but I didn't know that I didn't know that there was another way. You know what I
Sure.
mean?
Right. And they
So,
didn't tell you that they didn't know or tell you that there was another way.
oh no. I mean, I guess, I just don't think that they had any concept of women's maternal mental health. And
Mm.
I think that probably physically, all the physical stuff, they were good doctors.
Sure.
The surgeries and the knowing about the pregnancies and everything, but when it came to mental health, nothing.
Right. Right.
And they did actually at first refer me to a psychologist, and it was awful. It was a disaster, this psychologist, because basically he was like trying to find something from my childhood that had triggered this,
Oh.
and so we find actually my sister finally found me an OCD specialist.
Okay. Right.
Once it was like blatantly obvious what it was.
Hmm.
But and my husband kind of checked out. Um, Again, he was 27.
Hmm.
He had never dealt with anything like this before.
Right.
Um, a little bit, I think probably it was just that he was scared and he kind of got paralyzed.
Sure.
And part of it was also like nobody talks about it. So he just kind of thought, again, my wife is crazy. And,
Did
he
people
wasn't,
use those words with you? Like, calling
you
you
know,
crazy or telling you something's wrong with you, like that kind of stuff?
I don't think so. And I think Adam tried to be patient.
Hmm.
Um, I think at first with all the checking and everything, he really did try to like calm me down
Hmm.
and there's obviously you're not always supposed to do that and everything, but we didn't have any of the tools for any of that. Um, but he was, I think, scared, and also this time of life, we had just moved into a new house. We
Hmm.
had this amazing dog. We were pregnant with my first child. Like
Hmm.
all of these things that were supposed to be so happy and so wonderful, I was
Right.
sort of ruining for him.
Yikes. Okay. Right. I mean, there's
And
one of those pressures that you're saying, like that the myth or the pressure, whatever, is that you're supposed to be happy, and
yeah.
that's kind of it.
Yeah, and the women in his family had had amazing pregnancies.
Mm.
So there wasn't any there was no understanding of anything
Hmm.
because he just had never dealt with it.
Right.
And so, I think uh, that he was just kind of waiting for it to pass.
Hmm.
And as I got back on medication, I think in my third trimester, small dose, and from there, I think it sort of got a little bit better and then
Hmm.
dipped again after the baby was born.
Sure.
And it took a good 6 months to a year after she was born for me to really be able to have, I would have moments of enjoyment in my pregnancy,
Hmm.
moments of enjoyment when she was a newborn.
Hmm.
Um, but it was mostly anxiety.
Did the same fears that you had during pregnancy cross over into postpartum, like worry
Yes.
about contamination or cleanliness or harm,
Yes, I
those kind
would.
of fears?
I remember locking the doors under the kitchen sink where we kept all
Hmm.
the chemicals and the cleaning supplies and
Hmm.
everything. I didn't want to talk on the phone to people because I was afraid that I would say something terrible and they would come take my baby.
Hmm.
Um, I had hit and run OCD where I would
Hmm.
drive and have to constantly turn around, and I
Hmm.
mean, it reared its head in all the ways.
Right.
And then, I think that as probably mostly since I started, I mean, I was angry at the time at the doctors, I really was, because also my birth was all kinds of complications around that. But I was angry at the doctors, and I was angry um, at the fact that there weren't more women who had said to me, be careful about mental health and be
Mm-hmm.
careful picking your doctors. And,
Mm-hmm.
not to blame other women or anything because it's
Sure.
not their fault. The conversation wasn't there. And, and also like I did know people who had been on medicine during their pregnancies, but they didn't talk about it.
Mm-hmm.
And I didn't find out till later.
Oh, okay. Right.
Which was why when I started taking my medicine again, I told everybody. And I've continued to do so
Good.
because I want people to know that it's a thing. And I get a
Right.
lot of pushback about that, especially on social media and everything. But I don't care. It's
Good.
if someone had said to me, if one person had just said, you can stay on your medicine,
Right.
maybe I still would have had some of the OCD. Maybe it still would have been a struggle.
Mm-hmm.
But I mean, 2 years of my life would have been very, very different. And
Yeah.
and and all the time since then, because now it's this thing that happened, it's this trauma that I lived with. Yeah.
Right. I mean, absolutely. It kind of robbed you from being able to be present in your pregnancy. I mean, that when the
Yeah.
fear and the anxiety is that intense, that's
Mhm.
the lens you see everything with.
Yeah.
So there's like threats, it sounded like all the time, all over the place, to the
Mhm.
point where, I mean, it was impacting your physical health, like not eating. What about sleep? Were you
Oh,
sleeping?
no,
No.
definitely not. It was interesting that I moved back into my childhood bedroom because I really did revert back to a child.
Oh, interesting.
I really, I mean, and my parents, thankfully, my dad is a doctor, but he's a general practitioner, so he doesn't really know much of, not that he doesn't know much about pregnancy, but it's not a specialty.
Right.
Um, and my mom, they really, and my sister, the three of them pretty much nursed me back to health.
Mm-hmm.
They were by my side the entire time. My mom, just like when I was little, would lay with me in bed. They would bring food to my room because like I wouldn't leave my room. They would force me out on walks,
Mm-hmm.
once in a while.
Mm-hmm.
They'd make me take a walk.
Mm-hmm.
Um, but I had no life, and I was, kind of like a prisoner of my mind, and
Sure.
it was the scariest time of my life for sure. So yeah,
Right. So, yeah, yeah, absolutely. I mean, it's like a certain kind of torture almost to not be
totally,
able
it's
to escape
torture.
that. Like everywhere you look, there's something that could hurt you or hurt the baby. I assume some of it. I made an assumption in my comment. It was like some of the fear that you would be hurt or injured, or was it all that would go to the
No,
baby?
I didn't care at all if I was hurt or injured. In
Ah,
fact, I don't know if I wasn't pregnant that I wouldn't have injured myself.
mm,
I think that was what kept me from not doing it. Yeah, because other than that, I didn't really feel like I had anything.
okay. So, right. I mean, there's no way for an experience like that to not impact you in multiple ways, like every area of your life. It's
Yeah.
so much stress, and feels inescapable that like those like more what I would see as like depressive type wanting to escape that kind of pain
Hmm.
symptoms. I mean, how could
Yeah.
that not show up?
Oh,
It's when
completely.
you're in that, it's sort of a reasonable expectation that if you're suffering for that long, it's going to start to really, really feel so deep.
Yeah, and then there's the fear of, oh my God, the fear of, oh my God, I'm going to do something to hurt the baby or lose the baby. And
Hmm.
then on top of that, it's like, oh, and then my husband is probably going to leave me and everyone's going to be so disappointed. And, maybe now I'm going to be thought as crazy, so I'll never be able to experience life the same.
Hmm.
Like
Hmm.
everything was sort of riding on this. I made everything ride on this pregnancy. And and that was so it was like all this pressure on top of the fact it was sort of like, okay, but this baby has to be okay because now everybody thinks I'm crazy. And so if anything does happen, then I'm just gonna be like bereft and
Mhm.
left in this state of the entire world just thinking I'm kind of nuts and nothing to take the focus off of that.
Oh gosh. Right. So you couldn't make one misstep or mistake
No,
or wrong decision or
right,
whatever. And
right.
and that's nearly impossible when it's that intense for any decision to feel okay. Even if it is like by whatever your calculations are like the best decision, it's still like you make a decision and then there's all these other things you have to think about from that decision. It's just
Exactly.
like constant, it sounds like.
It was constant. Your mind doesn't stop when you have OCD. It does
Mhm.
not stop, and there are so many levels. There's the obsessions, there's the compulsions. Um, there's the just the cyclical everything, and then once you get over or once you're proven wrong about one thing, then you come up with something else in your head.
Sure.
And so it's really yeah, it was really an awful time. And again, I we've had the podcast, I think actually now almost 6 years, and it was one of the first episodes that we did was about my OCD with during my pregnancy. And it was something my husband and I hadn't really discussed in depth
Mm,
during that, following that period. We just kind of didn't really talk about it.
right.
Um, and I think that it wasn't until I had the podcast and had these resources and had the space to really dig deeper into it that I
Mhm.
really realized uh, it was malpractice. It really, to a certain degree, it was malpractice.
Sure.
um they did not have, for a doctor dealing with women, this is your job. You deal with women. And again, my dad's a doctor. I have wonderful doctors. I am not
Sure.
anti-doctor. I'm not.
Sure. Right.
But this was really, and so I think that I hope that young women or older women or whomever wants to
Mm-hmm.
get pregnant, I just hope that they know that it's finding a doctor, the right doctor, is a process.
Right. Yep.
And you can, it's okay to walk in somewhere and walk out and never go back.
Mm-hmm. Mm-hmm.
I
That
you
is
know
such a good point. I mean, you're right about so many things in there. Um, t- it's historically, women have been done a disservice. Um, I mean, we could talk for years about that, but
Mhm.
there's your experience of it just being like a clear, yep, yeah, yeah, you can come off that medication with no guidance or anything like that. Did damage to
Oh,
you.
for sure. A lot. And throughout, the way that I was treated,
Mm,
I was
right.
treated, like like an annoyance, a nuisance, taking too much of their time, too many phone calls. And I get it. I get you only have so much time and so many patients and whatever, but then you find the right avenues for the person.
Mm-hmm.
You get in there and you get them, you know, you don't just find them the one therapist that or you're connected to.
Mm-hmm.
That's part of pregnancy is the
Mm-hmm.
mental component. And
Mm-hmm.
nobody, nobody talks about that. I mean, now more maybe,
Mm-hmm.
but I didn't know that it was a conversation to be had with the doctors. I
Right.
didn't know it was hey, I have a history with anxiety and OCD. How do you handle
Mm-hmm.
those, you know, situations with women? What is your philosophy around it? What are your thoughts on medication? Have you had any special training with mental health? All of these things that I now know, to tell other women to ask. There was nobody there to tell me.
Right. Right.
So,
I
yeah.
mean, just those three or maybe four questions that you just outlined are so powerful. And like if people who are listening right now could like rewind, jot those down, because that's exactly it. You can ask questions. I mean, uh, to put it one way, you're like you're trying to hire somebody to do a job, and you need to know like how they do their job, and if
Yeah.
they're going to be able to take care of you the way that you need. And to your point, like not everybody's going to be a good fit.
Hmm. Yeah,
Uh,
and then if someone says, the person who referred me to these doctors had said to me, they were obsessed with this group of doctors. They were like, oh, they're amazing. They spoke about them on a godlike level, and for that person, I think that's wonderful.
mm-hmm,
But the assumption cannot be that a group of doctors that is wonderful and incredible and godlike for one person is going to be for
mm-hmm,
another who has completely different um, you know, characteristics and
mm-hmm,
a different history and different issues. And, that's just, you can say you love a doctor all you want and you think someone else should use
mm-hmm.
them, but is that the right doctor for them?
Yeah, yeah, that's
So,
a really great point.
mhm,
Um, just the fact that I mean, what you were saying that you could go in, as anybody could go into a doctor and then never return to that doctor, I think is a really important one. It,
yeah.
I think I'm going to make a generalization here, but women more than men, let's just say, if I'm going to be sort of binary about it, um, feel more of a pressure to stay with a provider.
Mhm.
They don't want to hurt their feelings. They, whatever, they want to like believe in them, or like those kinds of things happen a lot. We're sort of like conditioned in some way societally to think like that, or feel like we need to give people more chances than we need to. Just
And it's a pain in the
giving
butt to
permission.
change doctors.
Yeah.
It's not an easy process,
Hmm, hmm.
and here they know what, you got to start from scratch again.
Right.
It's not really the easiest thing to do, and meeting with
Sure.
new doctors can be, just I'm the first person who like I avoid calls and all that
Sure.
stuff at all costs, so I get it. But you know, this this kind of has to be an exception, and also
Agree.
maybe the leading up to the pregnancy.
Hmm,
Um, there needs to be a lot of research
hmm,
done.
hmm.
So that maybe the first doctor you go to is the right one,
Sure.
better
Sure.
chance if you've done the research before.
Yeah.
Yeah.
Yeah, that's true. I mean, there are a lot of also systemic issues that it could be that it takes 2, 3 months to get to another doctor.
Mhm.
There are real reasons to, you know, to
Totally.
hesitate or to not switch even. But
Mhm.
yeah, that like advocating for yourself and just having the information that you're, you're talking about is the one part of feeling empowered.
Yeah.
But yeah, 19, 20 years ago, that wasn't really where we were at.
Yeah.
We are more so now, like people like you and other folks who are talking about it make it more possible to get that help.
Yeah, and I
Um,
didn't have that aspect of my personality that I have now, which is sort of like the who cares if anybody knows.
yeah.
I didn't even really give my friends a chance to support me.
Mm,
Whereas now I definitely would just tell. I mean, everybody would probably know.
mm-hmm,
I would shout it from the rooftops,
mm-hmm.
rooftops because I just have a. That's just I've grown, and that's just who I've grown into.
Right, sure.
But back then, I think I was still so insecure
Mm-hmm,
about myself, and I felt like I still had to prove myself in so many
mm,
ways.
right.
And I think I think becoming a mom, both my own family and the family that I married into, there was so much weight on becoming a mom,
Mm-hmm,
that also probably affected it all. That it was probably like this, like, oh my God, I'm gonna fail.
right. It does feel like that, doesn't
Yeah,
it? All right.
yeah,
So, sure. So that's pretty silencing. To
yeah,
I mean the that growth that you described, like that you don't care anymore, the stuff back then was I mean I heard it pretty clearly. You said that like that worry that you would think other people were crazy, would think you were crazy, or at least that they're having some judgment um about you. But like all of that stuff makes people feel silenced. You start to feel like ashamed,
Mhm.
maybe even guilty. And once that starts stacking up, it can feel really hard to reach out,
Yeah. Yeah,
to
I
be honest.
definitely did not feel like I could talk. I mean, I didn't even have the energy to talk to people about it. I didn't really I I didn't have the motivation. I
Mm.
nothing. Yeah.
Right. And I think from what you're describing how it felt, you're so like inside of your head and inside of your body that like in a way that feels really like preoccupied,
Mhm.
um that it's hard to even think like, oh, I should reach out to so and so. Like you really need people to come and take care of you.
Yeah. Yeah, but also you have to let them in, and I don't even know that I would have let them in,
Mm,
which, obviously now it would be different.
mhm,
But I also think that when you're at transformational, like, points in your life, I think you're more prone to, going down these spirals and everything when you don't feel grounded in
mhm,
anything. And again, I was newly married, I had a new job, living in a new place, all of
mhm.
these things. I felt very uh, untethered.
Sure.
And
Well,
so
like a lot of change at
a
once.
lot of change at once. Yeah.
Mhm.
Yeah.
Which
Hmm.
I think like if you're well, I know if you already are having anxiety or OCD, like that becomes harder to manage when things are unknown and everything's
Yeah,
new and
for sure.
different, and
Yeah.
it's kind of like a natural place to feel a little more worried,
Yeah. Right.
if not a lot more
Yeah,
worried.
exactly. Yeah.
That's
So that's sort of, and again, I feel like as I start following different people, like I found you, I don't know, maybe 4 or 5 months ago,
mm,
and, before that, I've, had heard some other, doctors talk about it and everything. I feel like with these different steps, I'm constantly, like, unpacking more and more with it,
mhm,
and I think I will be my whole life.
mhm,
I and look, I think that, in a lot of ways, I'm grateful it happened now,
mhm,
I'm not grateful to the people who allowed it to happen and who
mhm,
caused it,
mhm,
but, certainly, I look at life differently every day
mhm,
because of it, and it is something I think about every day. It is a time of my life when, when I felt the most like, "Oh my god, I would do anything for a quote unquote normal moment."
mhm.
And so you take those normal moments, and also you realize, you know, uh, how trivial so many things are.
Sure.
And so, I do have this platform now, and I do feel very responsible for using it in a certain way, and it's a tricky thing to be, in the creative space as a content creator, right? Because,
Right.
again, people are judgy and there's all kinds of voices coming at you from all places, and you're losing followers when you say
Mm,
this or whatever, and if you want to grow and
mm.
it's a whole
It's a
mess.
lot. Yeah.
But
Yeah.
I think that just being true to myself and telling the story, knowing I would have done anything for someone to tell me their story at the
Mhm.
time,
Mhm.
because I didn't know anybody who had gone through it. Nobody. Not to say I didn't know anybody who had gone through it.
Right, right.
I
Yeah,
didn't
right,
know
right.
anybody who was willing to share.
Mhm.
Um, and so I think for every woman who shares, and every woman like you who gives this opportunity to share,
Mhm.
is amazing. And we just have to keep the
Yeah.
conversation going. Yeah.
Absolutely, we do, and thank you for that. I mean, I had my own experience, which is why I do this now, and similar to like you've had life experiences, and you don't want anybody else to suffer in the way that you did, and you're sharing and making real things real for people. I think when it's behind this. that like wall of shame that prevents people from sharing
Yeah.
is so silencing and so strong that, right, just if you had heard one person talk about this,
Yeah.
it would have potentially given you permission um,
Absolutely.
to,
Yeah, it would
to
have given me permission, and it would have given me a plan, probably,
mm,
some
hmm
some type of understanding of, well, wait a minute, the steps I need to take to be pregnant are different from
hmm
those of most women or
right,
many women. And that
yeah,
we all, pregnancy, we think of pregnancy as this universal thing, um, you know, and we talk about pregnancy on this very general, generic level. It is extremely nuanced and it is
totally.
extremely fragile, and not
hmm
just, the idea of the baby, but the mother and,
hmm
and the experience uh, of having to like walk through the world, during all that time and the time following and the time previous. Am I going to get pregnant? This and that, all the things, to walk through the world and, and have all of these uh, expectations
hmm
and, and forget the physical or whatever. But,
right.
but we need to, yeah, we need to give ourselves and each other
hmm
room
hmm
to, to express ourselves around about it. Yeah.
We do. And one of the other things I really appreciate about you sharing is, and the way that you're sharing it is, other people many years later will realize what they had gone
That's
through
right.
and not have known what was going on at the time.
Mhm.
Maybe still harbor that shame or the embarrassment or feel like they can't talk about it, but the healing is available anytime. It
Yeah.
doesn't have you, similar to what you said, like you will find pieces of healing through this
Mhm.
for however long.
Yeah.
And I do too, still like, oh,
Yeah.
there's like a sore spot I need to attend to, and that is normal. Um, and even normalizing that for you, what you're doing today, that you can get healing and find healing whenever is
Mhm.
really, really powerful. People need
Yeah.
to know that too.
Right, right, that there are spaces to heal, exactly. And I think, with the doctors, because that is one of the things that I think about the most, right, is
hmm
the doctors and how they were never held accountable for it. And look, again, who knows how many other women with mental health issues walk through that door because they have this incredible overall reputation, and
Right.
because, for a woman who is healthy, having a normal pregnancy, they're probably very wonderful doctors.
hmm
However, for those who are not, they're not.
hmm
And when you and it's scary. A doctor is such a prestigious, respected, profession that it's
hmm
a difficult one to push back on.
It is.
Yeah, especially when you are in a situation where people might think you're crazy.
Right, like you're in a vulnerable um position. At
Yeah,
that time especially, like you didn't have the information
yeah,
to help like bolster you with the doctor.
yeah.
Like you couldn't have just gone and printed out this like sheet that said, "Okay, listen to me because this thing is real," because you wouldn't have
Exactly.
known to even go look for it.
That's right, that's right. Yeah, and I did write them a letter after, when I
Oh, good.
switched practices, and, they do the call of, "Why are you switching?" And I
Mm-hmm.
told them to the best of my ability at the time why I was, in very general terms. I think it was, probably one of the administrators from the office who was calling me, not one of the doctors, of
Mm-hmm.
course. And so, I did that, never went anywhere. But, certainly, at the time, it would have been great if I could just say to people like, "Hey, you know, if you have mental health issues, this might not be the place for you."
Mm-hmm.
So, yeah, yeah.
With your journey, I know you've talked about it on your podcast, and you've talked about it with your husband. Since you guys have had some, space and time to reflect on that, um, uh, and time to find some healing too. What
Mhm.
are things either that you or the two of you have thought through, like, oh, it would have been outside of a physical, like medicine care, what else would have been useful for you at that time?
Yeah, I think it would have been useful. And he did go to therapy with me a bunch of times towards the end of my pregnancy when I found the right therapist.
Mm-hmm.
He did come and try to understand. And
Mm-hmm.
like I said in the beginning, when things really were awful and he had no clue what was happening, he
Mm-hmm.
did try to be patient. But certainly, I would, reflecting back, I would think that these were conversations that needed to happen between us before I even got pregnant, you know? Of
Mm-hmm.
course, again, we didn't know
Right.
to have those conversations.
Right.
But I think that the prep, the leading up to when you're trying to get pregnant, no matter whether you get pregnant right away or you get pregnant in 6 months or you wind up going through IVF or, whatever circumstance, or even if you don't wind up becoming parents, it's a process and it's a
Mm-hmm.
journey and it can be intense.
Right.
Um, and so, those it's not just about baby showers and gender reveals
Mm-hmm.
and and all, picking out the layette. It's real crap
Right.
that you need to
Mm-hmm.
um to talk about it. And when you don't want to talk about those things in the fun times, right? You
Right.
want to concentrate on the beauty and the magic and not the, oh crap, well, this might take a turn for the worse.
Mm-hmm.
But in that moment of it taking a turn for the worse, you'll be very happy you had those conversations.
You are 10,000% correct there. I mean,
Uh,
it is hard. And I think that's part of the reason why people don't have the hard conversations is because there's all these like background pressures of it's supposed to be the most magical time of your life and all,
right.
like all of that stuff. Um, but like as you experienced, it is a massive life transition, anyways, without all of the other things that you might be dealing with and all of the things you're saying and I think suggesting for people to do are spot on.
No, thank
um, Spot on.
And that means a lot coming from you because I know that you actually know. And sometimes when I'm giving this advice or people ask me, as someone who is obvious, I'm not an expert, although, I am kind of by like, you know, secondhand talking to lots of experts and everything. Not that that
Hmm.
makes me an expert, but um, I always want to make sure that I'm not just taking my own personal experience and sort of stamping it onto somebody else.
Hmm.
So, and I try not to, but also,
Sure.
yeah.
I mean, I appreciate that too because you're in, social media space quite a lot and
uh,
um the fact that you can think it like that way in a nuanced way and be thoughtful and careful that just similar to how you were saying like your friend really wanted you to go to this doctor and it was a great doctor, it wasn't a great doctor for
That's
you
right.
and that you're applying that to how you're talking about it here is um that yeah, people can and should be thoughtful about their providers and one size doesn't fit all, but there are still things that run through that have a thread at least that runs through like what you're talking about, the communicating beforehand, having the hard conversations, thinking about the providers that you have and asking them questions. um, that is so important and it's empowering, it's stress relieving, it's preventative. I mean, there's so many things that you're
Right.
describing in there that right, it's not going to be some magic cure all that you're not going to experience anything, but you're at least reducing the risks of stress.
Hmm. Yeah. And another thing, and it's hard because you want people who obviously are just enjoying their pregnancy and everything. You don't want to take that away from them. You want
Right.
them to be able to just enjoy. But I think as a society, one thing that we need to really think about again, is the language and everything and the energy that we're putting out there. Because there are so many women, probably as many struggling as aren't,
Mm-hmm.
in some capacity, whether it's trying to get pregnant, dealing with miscarriage, all of the things, um, you know, that, and this might be more of a generational thing, and hopefully with each generation it's getting less and less, but it's the most magical, it's the best time of your life, it's you're glowing, you're this, you're that. um to set up that those standards and expectations, then you are setting someone up for failure who
Right.
can't do that.
Right.
um and so to say instead, my experience was
Mm-hmm.
X, but I also will be there to support you and understand that your experience might be Y. You
Mm-hmm.
know, so
Mm-hmm.
um, so I think
Absolutely.
that even if it's you're not worried yourself or you haven't gone through it yourself, just to sort of be a woman of the world and in support of other women and men too.
Mm-hmm.
I'm not just saying women, but men too. But
Mm-hmm.
just to be able to make sure that we're creating an experience that allows for all experiences.
Amazing. Well, Danielle, thank you so much for sharing this today. I know we're just getting like a snapshot of some really, really difficult time in your life. And I just so appreciate that whatever you've learned from that for yourself, you're trying to pass it on and help other people to not have to suffer in the way that you did. I just really appreciate you taking the time to share today.
Oh, thank you. Thank you for giving me the space to do it and for giving all the women and, everyone a space to do it because it's we need these spaces and, unfortunately they're not as plentiful as they should be. So thank you. I really appreciate it.
Absolutely. Please get connected with Danielle at marriageandmartinis.com and also on Instagram at marriageandmartinis. And go check out her podcast. Go listen to the episode that I shared with her last week on her podcast. And be sure to share these conversations, both from her podcast and on Mom and Mine, because these really like are such important messages to get out and conversations to have. And as you heard from her story today, it is so important to know that somebody out there has had a similar experience to you and that they've made their way through. They've found healing, they found the other side, so that you can know that healing is possible for you as well. I thank you so much for joining us in this conversation. Until next time.